Oncology navigation is removing any barriers to care that patients may come across. So any of the day-to-day things that could potentially get in the way of patients coming to get the cancer treatment that they need. Oncology navigators try to remove barriers to care, such as transportation issues coming back and forth to treatment, insurance issues, things that come up for patients that if a treatment isn't covered 100%, are there services we can provide to them to find other solutions? We don't ever want somebody to make a choice about coming for treatment or not coming for treatment because of a barrier to care that we might possibly be able to remove for them. There are a lot of options for patients with transportation barriers. We work closely with some volunteer organizations that have volunteers trained to bring patients back and forth to treatment. We also work with government agencies at the county levels usually. We have a wealth of resources in this area with public transportation as well. So there's really hardly ever a situation where we can't get somebody help getting back and forth for the care they need. We have an incredibly generous community here in State College and the surrounding area. There are a lot of organizations that are passionate about cancer care and our mission here. And so we really utilize a lot of local foundations and know which ones pay for which things and how much they will pay, and really how to assist patients. A lot of times with cancer treatment, you have to be off work and things like that, and so it affects the day-to-day bills and other things. So we try to work with organizations to find patients some help during that difficult time going through treatment and recovery. There's never a fee for oncology navigation services. Mount Nittany Health has really invested in having oncology navigators to help people through such a difficult time. From diagnosis all the way through survivorship, we're available to patients. It's really important that patients have a starting point of, I don't know who to call, so I'll call my navigator, and if we can't help, we can always figure out who can help or who can answer their question and make that connection for them. It's just one less thing for patients to have to worry about, and we are a wealth of resources for people, so we can do all of that. Patients are typically referred by their physicians or a nurse in the oncology office, but we don't have to have a referral from a physician, so patients can contact us directly. Caregivers can reach out to us, email, phone. They can also go to the website for more information about the oncology navigation program. The best advice I would give to patients and their families would be, don't ever hesitate to call. If there's something that you think nobody would have an answer for or a solution for, just call us. 99.9% of the time, there's something that we can do. And if we don't have the answer, we can certainly find somebody who does have the answer. We never want somebody to be distressed about something that we could have potentially either avoided or at least solved. So just call us.